If you feel like you're living in this cycle of UTIs, antibiotic relief, then boom, it's back, this video is for you. Today we're going to talk about methenamine hippurate and why it's a game changer for people who have been suffering with recurrent UTIs. Hi everyone, I am Dr. Jasmine Bonder. I'm a critical care nurse practitioner and I specialize with people who have been suffering with recurrent infections. Now I want to talk about something a medication that really comes top of mind, and honestly patients ask me about it, but it really isn't talked about enough as to why we use it, and it's called methenamine hippurate. So let's break it down for what it actually does, who it helps, and honestly why it's different than antibiotics. So let's start off what is methenamine hippurate and what isn't it? Methenamine hippurate is not an antibiotic, and I think that's critical. Instead of killing the bacteria directly, it works by preventing bacteria from growing inside the bladder wall, really in the first place. So what does that mean? When methenamine reaches acidic urine, it converts into a compound called formaldehyde. Now don't panic, this happens only in tiny localized amounts in the bladder. And that environment makes it really hard for UTI causing bacteria like E. coli, Klebsiella, Enterococcus to survive. Now, why does this matter for recurrent UTIs? Really because when people have been suffering, they get on antibiotics and it can really disrupt the gut and vaginal microbiome, really increases the risk of resistance to antibiotics, and sometimes it actually makes the infection come back even stronger. So methenamine hippurate helps reduce UTI reoccurrences without damaging your healthy, normal microbiome. And I think this is huge because if you've been on multiple antibiotic courses, it's something to consider to add to your medication routine. Now, who does this benefit? It often benefits individuals who've had frequent UTIs, so 2 or more in 6 months or 3 or more in a year. They want to avoid long-term antibiotics, so this is a good solution here. Having negative or inconsistent urine culture, or people who've been suffering with post-UTI symptoms, or even may have bladder hypersensitivity. Not for patients who have interstitial cystitis, big asterisk there. And also, this is a preventative strategy and not something to treat for active infection. So a couple things for you to know. Methenamine hippurate, for it to work, your urine needs to be acidic. Highlight star that. So some people pair it with vitamin C or really other dietary strategies, but this really should be a guide with your clinician to make sure it is the best for you. And if you have kidney issues or certain conditions like I see, this needs to be with careful oversight or may actually not be appropriate. So truly, if you've been stuck in this cycle of recurrent UTIs and feel like antibiotics aren't the answer anymore, methenamine hippurate may be an option worth discussing. And if this video helped you, like and subscribe. And if you